everyone, Eileen the Bam here, and welcome to the third installment in our little mini mental health series on bipolar disorder. As you can see from this, today we are going to go over the diagnosis of bipolar. Just a little recap. In the previous two, we discovered what bipolar disorder is. The second one, we discussed the three different types of bipolar and how it affects the brain. And in this one, we are going to go over the diagnosis of bipolar disorder. So saying that, let's get started. Bipolar disorder is commonly diagnosed during adolescence or early childhood, but onset can occur throughout the life cycle. So normally they find out if a person has bipolar disorder in early childhood or adolescent years, but it can occur in adulthood, but it normally is in childhood at some point. This disorder can be difficult to distinguish from unibipolar depression, and the average delay in diagnosis is 5 to 10 years after the symptoms begin. Diagnosis of bipolar disorder takes in several factors into account and considers the self-reported experience of the symptomatic individual, abnormal behavior reported by family members. So when they diagnose this, one of the things they do is they don't just listen to the patient, they listen to the patient's family, let them describe what they've seen and stuff, because it's first-hand experience, and that helps for them to diagnose if it's 1, 2, or unibipolar. And also friends and co-workers, observe signs of illness by a clinician, and often will work up a workup team to rule out any medical causes. Okay, and in diagnosis, caregivers help with it, and most of it's done on an outpatient basis. But if they believe the person is at that point where they could do harm to themselves or to others, they will do a diagnosis in care, which means in the hospital, where they will be admitted while they do it. The way they do it is when they do their assessment, they have like a scorecard, and that's one of the ways they do it. And the scorecard is a rating scale, and it goes, basically they get information from the mother because they find that to be more accurate than teacher and youth report in predicting and identifying youth with bipolar disorder, because the mother's there with the child more often, so she's going to see more of it than a teacher would or somebody else. So a lot of times that's why they'll listen to the mother's report first and foremost, then take in an account any other type of outsiders like teachers or caregivers. The assessment is usually done, like I said, on an outpatient basis, and they only do admission on it if they feel the person it could be dangerous to themselves or to others at that point. Then they will do the inpatient. The most widely used criteria for diagnosing bipolar disorder is from the APA, the American Psychiatric Association, and there is no biological test for the diagnosis of bipolar. But they will do blood tests to rule out different things, blood test and or imaging. They may do to exclude any medical illnesses with clinical presentation similar to that of bipolar disorder. Also, an EEG may be used to exclude neurological problems that might be similar. So, they will, when they do an assessment, they do the process of elimination, so they'll probably do some blood tests and some MRIs and do some neurological tests like an EEG to exclude things like MS, partial seizures, strokes, brain tumors, Wilson's disease, traumatic brain injury, Wilson's disease, Huntington's, and complex migraines. So you see, they have like their scorecard they use, and they do other tests to make sure that they get the proper diagnosis, because bipolar is a very serious mental illness. As we said before, when a person goes in it, they don't have an even, they're like this. They go from an extreme high to an extreme low. So it's important that they make sure that they cover all their bases. So normally when a person's going to be check to see if they have bipolar disorder, they listen to the mother, and then they listen to teachers, caregivers. They will do a scorecard with them on different things to find out if there's any manic episodes or whatever. They will run blood tests and do imaging to rule out other things. They'll run an EEG to make sure there's no neurological problems involved. So they will cover all these areas before they come up with their final decision and diagnosis, is if that person has bipolar, which is very good, to make sure, because a lot of doctors, I know, like with my doctor, one time when I had headaches, I would take Advil and it wouldn't go away. Instead of doing tests, they wanted to hurry up and offer medication. Which, I'm glad that with a lot of mental disorders, they do not do that, because you don't want to be medicated for the wrong thing, because you will have a different effect than what you need. So there's a lot involved. Tomorrow we'll go through a lot of this. We'll cover the spectrum of it, because it is like autism. It does have a spectrum. Not everybody experiences the same. As far as the spectrum, it's somewhat like autism. I mean, the symptoms of it are completely different, but the spectrum, it's there. Some are high in the spectrum, some are low, some are in the middle, some are, in different areas. So I want to cover that so you have as much knowledge of this as you can. So that will be tomorrow's video, is on the spectrum, on how wide and far it is, and then we'll go from there. So until tomorrow, remember, yes, you right out there, you matter to me. You're important, you are uniquely made. And I love you for you, I accept you for you. And remember, if you ever need help, please reach out. Whether you're suffering from any of these that I have discussed earlier, or you just feel you need somebody to talk to, reach out, I'm here. And remember my motto, which is the very most important thing, to remember to see from your heart, not your eyes. Because when you see with your eyes, you only see the outside. You see from the heart, you see within to the outside, and you get a more deeper appreciation of that person, a more deeper understanding. You see them for what they really are, not what they look like. It's kind of like reading a book. If you get a book, you look at the cover. The cover might look awesome, but then when you read the book, it's like, oh, this is horrible. Or you may get a cover that it's like, this don't look interesting. And then you start reading it, and it's like, oh, I can't put this book down. That's why you always don't judge a book by the cover. And that's the same thing with people. It means see with your heart, not your eyes. Okay? Until tomorrow. Bye.